a Dutch shepherd, which presented to us, it's 4 years old, presented to us with a left forelimb lameness and had elbow pain. Already had some radiographs, which we didn't really pick up much on the radiographs except for some arthritis in the elbow joint. Didn't see an obvious fragment, but I was assuming that this was going to be elbow dysplasia, just based on the history and the breed. We're getting a little bit light, please. And so we had every intention of going in, doing a CT scan and going in and just retrieving a big coronoid fragment. What do you need, Anne?
Oh, no, I'm just making sure you guys are okay.
Okay, thank you. Retrieving a big coronoid fragment. And then we CT'd it and found out that there was a big fissure in the humeral condyle. And was not expecting that. I've never seen one in a shepherd, only ever seen them really in spaniels. And it looked like this was mere weeks away from fracturing off. And I have to say, we really dodged a bullet, because my recommendation with the owner was, given that it was improving, was to be conservative. Because the outlook with elbow dysplasia is not great. Like, we don't cure any of them. We really don't change the course of the disease very much with surgery. And so I had told the owner, look, if it seems to be improving, we could just manage it conservatively. And the owner was very keen to find out exactly what was going on and to potentially treat it for its elbow dysplasia. And so we did the CT scan, and lo and behold, we found only found the humeral intercondylar fissure that's extending quite far up the humerus. So here we are. There's already a comment saying you're surgery on VetAlign. I just, in order to get the maximum audience, I just did the short transmission on VetDojo, because that has the 69,000 subscribers, but the actual surgery is being streamed on both. Now, very importantly, we have a structure here that we need to be aware of, and that's the radial nerve sitting right there. I don't know if you guys can see that, but that radial nerve is coming out underneath the vastus lateralis, and if we have to go very far up that epicondyle with a plate, for example, we will have to be careful that we don't damage that radial nerve. So I'm making my approach onto the humerus, and I can feel the periosteal proliferation up there. Come up right up to that radial nerve. That's actually probably the best view I've ever seen of the radial nerve. I'll just adjust the camera a little bit. So this is exactly the same condition as incomplete ossification of the humeral condyles. So that is all of our periosteal proliferation here, coming down onto the epicondyle there. We've got some periosteum right here. So that's all periosteal proliferation. You just have to be very aware of that radial nerve. And then I have to decide whether I'm going to plate this or just put in lag screws. Now the headless compression screw system is really lovely to use. So that's what we're going to use here. I'm just palpating the two epicondyles, figure out where I'm going to put my headless compression screw. Now we have to find the correct pin. So we drive a pin across first, find the correct pin. It's going to fit inside the drill bit. That is too big. That is too big. That is just right. So it is an 0.35 screw. So what I need to do is I need to drive this across. You could do this with fluoro. I'm just going to palpate. I'm going from the most prominent bit of the bone, aiming for my index finger. Come out caudal. Okay, so I've come out exactly in the middle of the medial epicondyle. So that's my first pin there. I did not use VPOC for measuring, although you certainly can. I just used our normal PACS software. That's still centered there, yep. All right, so the next thing we do, and I have pre-measured, it's a 44 millimeter screw. So the next thing we do is we drive our our drill bit, which is over over that pin, so it's a cannulated drill bit. And I'm just going to set my set screw to about that. And then we run the drill bit right over the pin. And that's going to direct it's going to direct the drill bit exactly where I wanted it to go based on where the pin went. I'll just draw my pin back across. Okay, next we are going to use this little tap here, which is just going to...
I think we're out of the camera.
What's that?
I think we cannot see the screw when you show them.
I beg your pardon?
It's at the edge of the camera.
Oh, okay. Yeah, so we've got this little tap here. So I'm just going to drive this into ream the proximal cortex. Okay, and then we're going to drive our 44 millimeter headless compression screw over that pin. So can you guys see that? And then everything is cannulated Okay, so that's placed beautifully there, and I know that that's going to be in the right place. So I'll just run it through range of motion to make sure that it's not affecting my flexion or extension. It's a little bit restricted in extension, but I think that's probably related to the periosteal reaction that we have. Now the next thing we're going to do is we're going to drive a couple of lag screws across. So can I get the 3-5 kit, please? And 3-5 screws. And I will put this patient on amoxiclav. I have it on cephalexin for the surgery. I won't keep it on amoxiclav after the surgery. And I will put it on paracetamol and meloxicam for the post-operative period. It's already been on meloxicam and seemed to respond to it nicely, so there was no reaction to it, so I'll just stick with that. So that is my 0.35. So what I'll do is I'll drill my initial hole. I think I'll use lockers, so I'll use a 2.8 millimeter drill bit. And my drill guide here. And then I need to measure the length. And that's measuring 28. So we'd probably put a 30. 30 locking, yeah. And then I'm going to over drill the near cortex with a 3.5 millimeter drill bit. So just over drilling that so that we'll be lagging the screw. Did you?
We got a question saying, is it possible to approach it with a C-shaped cut on the caudal aspect of the elbow?
Possible to approach it with a C-shaped cut. I'm not sure what you're referring to. Can you explain that a little bit more clearly, please, your question? A C-shaped cut on the caudal aspect of the elbow. I'm not sure exactly what you mean. .26, so we'll put in a 28. 28 locking. Okay, so that's pretty much it. So we've got our intercondylar screw. Let's see if I can get that better view here. So I've got my intercondylar screw here, and then my two lag screws there. There's a question about paracetamol being toxic in dogs. It absolutely is not toxic in dogs. It's completely toxic in cats, but not at all in dogs. You can use paracetamol. It's probably the safest pain reliever there is in dogs. Can I get some bupivacaine, please? All right, so that's pretty much it. We're just going to inject some bupivacaine into the muscle. C-shaped incision on the caudal aspect of the elbow to approach the elbow to get access to the condyles. C-shape, I assume that you mean back here. Yes, you probably can. If that's what I understand, just making cutting more through the insertion rather than the body of the muscle. There, you probably can do something like that. What's that?
5 and 3?
Yes. And again, really nice view of that radial nerve sitting right there. If you haven't subscribed to VetAlign, go ahead and do that, because at some point I'm probably just going to stream on VetAlign. I'm just getting my bupivacaine. All right, so not injecting into the radial nerve. And some OPDS, please. So I use PDS because that's what we have on a taper needle. I always prefer taper needle over a cutting needle, except for very few situations. So, and I kind of was brought up on PDS, but monocryl for the intradermal layer would be completely fine. Stop speaking Portuguese at home.
What was that? Just Portuguese?
Yeah.
Oh, so cool.
I knew that was Clara. Yeah, Portuguese.
Oh, yeah.
Now I've got an FHO, femoral head and neck ostectomy, in a little dog with probably a proximal femoral neck fracture that I'm going to live stream next this afternoon. So that should be in the next kind of hour or two, I would imagine. Can I get some 2O PDS on a cutting needle, please? I took about 2 years of French in high school, and we were in the Champs-Élysées in Paris, and I was telling the crepe maker that he made the best crepes in all of Paris, and I was speaking, I got about halfway through in French and then started speaking English with a French accent, inadvertently, and my sons, who all spoke French, were just laughing at me hysterically.
Kind of cute.
As my sons do tend to do, laugh at me hysterically. All right, so I'll leave Cindy to close the intradermal layer. You happy to do that?
Yeah, sure.
All right, and I'll just come back and make sure there aren't any questions that I haven't missed. Wound soaker, look, that wouldn't be a bad idea. We don't have good access to wound soakers here. I could use just a normal urinary catheter or something like that to soak the wound with bupivacaine in the postoperative period. I find that just an injection into the soft tissue to be adequate. Yeah, certainly wound soaker would be a consideration here as well. So the software that we use is called Rocket Packs. You can also use Horos. Horos is a freeware for the Mac, which works really well. Namaste, India. And it's hard for me to show the x-ray during the surgery, but I did a video just before this. So if you look at the live stream on VetDojo, where I go through the preoperative planning, regarding periosteal proliferation, I'm not concerned. All that tells me is that that was unstable, and so we definitely needed to repair this. So I think that's pretty much it. If you haven't already done so, please subscribe to our channel. Make sure you turn on notifications so you'll get a ding on your phone the next time we live stream. And we'll see you again in probably an hour and a half where I'll be live streaming a femoral